How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was, a battling stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Good afternoon, colleagues. Can I just remind members, as always, that social distancing measures are in place throughout the campus, and in fact there are new one-way systems in place, so just to be careful, particularly when entering and leaving the chamber this afternoon. Now, the first item of business today is a statement by the First Minister. I would encourage members who wish to ask a question to email their intention to ask a question to the business team, as the voting consoles are the voting buttons are not working, so to email their question, not email the question, email their indication that they wish to ask a question to the business team. And I call on the First Minister.
Presiding Officer, the Scottish Government is required by law to review lockdown restrictions every 3 weeks. The latest review falls due today, so I will shortly update the Chamber on the decisions that we have reached. First, though, I will report on today's statistics and other developments. Since yesterday, an additional 17 cases of COVID have been confirmed, which takes the total number now to 18,597. A total of 260 patients are currently in hospital with confirmed COVID, which is the same number as yesterday. And as of last night, 2 people were in intensive care with confirmed COVID, which is the same number as yesterday. And in the past 24 hours, I'm pleased to report that no deaths have been registered of patients who had been confirmed as having the virus. And the total number of deaths in Scotland under that daily measurement, therefore, remains at 2,491. In fact, no deaths have been registered under this measurement now for the past 2 weeks. However, we mustn't lose sight of the fact that every death is a tragedy, and I want again today to send my condolences to everyone who has lost a loved one to this illness. I also want to give a brief update on the identified cluster of cases in the Greater Glasgow and Clyde Health Board area. I can confirm that as of now, 8 positive cases have been confirmed. These are linked to the M&D pharmacy in Port Glasgow and to an Amazon warehouse in Gourock. I want to thank those businesses for acting swiftly and for fully cooperating with the guidance and procedures to contain this cluster. An incident management team led by NHS Greater Glasgow and Clyde met yesterday afternoon and will meet again today. It's working with the Scottish Government, Health Protection Scotland and local environmental health teams to trace contacts and do everything possible to minimise onward transmission, and I'm very grateful for these efforts. We will of course provide more details as and when they become available. I also want to draw attention to an important announcement this morning by the 4 UK Chief Medical Officers. This relates to a change in advice for those who test positive for COVID. Up until now, people who test positive have been advised to isolate for 7 days. But because it is thought that the infectious period can last longer, the advice now is that people who test positive should isolate for 10 days. Contacts of those who test positive should continue to isolate for 14 days, and quarantine for people who have been travelling from non-exempt countries also remains at 14 days. So this change only affects people who test positive, but it is an important change to guidance and therefore one that everyone should be aware of. Let me turn now to our review of the lockdown restrictions. The statistics we've been reporting each day for the past 3 weeks demonstrate the progress we have made. Incidence and prevalence of the virus are, as of now, at very low levels in Scotland. 3 weeks ago, we estimated that 1,000 people had been infectious with the virus in Scotland the week before. Our estimate for last week is that 300 people in Scotland were infectious. In addition, our latest modelling suggests that the R number remains below 1. So our progress is real and substantial, and it has, of course, been very hard-earned by everybody across the country. But, and I'm afraid this is a necessary but, the virus has not gone away. It is still circulating in Scotland and it remains highly infectious and very dangerous. And that is why I am not able to indicate today a move from phase 3 of our route map out of lockdown to phase 4. A move to phase 4 would require us to be satisfied that the virus is no longer considered a significant threat to public health. Unfortunately, that is far from the case. For that reason, the Cabinet decided yesterday that we will remain in phase 3 for now. And while we will consider this every 3 weeks, it is possible that phase 3 will continue even beyond the next review point. That decision and the fragility of our progress against the virus means that changes over the next 3 weeks, beyond the 2 significant ones that I will come on to, will be minimal. However, I will give some indicative dates for when we hope additional activities and services can resume. Although we cannot move to phase 4 today, the progress we have made does allow 2 important changes to happen in the next 2-week period. I am very pleased to confirm that from 1st August, we will pause the advice for people to shield. For those of you who have been shielding, this means that from this Saturday, you can now follow the guidance for the general population. But please be especially careful about face coverings, hand hygiene and physical distancing. The pause also means that children who have been shielding will be able to return to school and adults will be able to return to work. Of course, our advice, not simply for shielding people but for everyone, remains that you should continue to work from home whenever and wherever that is possible. And if you are returning to work as a shielded person, please know that guidance is available for you and for your employers on the Scottish Government's website. This guidance allows you to calculate an individual risk score to help you and your employer make your return to work as safe as possible. It was developed by clinicians and occupational health experts, and we have worked with COSLA, trade unions and business organisations to make sure it is quickly adopted by employers. I know that the pause in shielding will be an enormous relief to many, but I strongly suspect it will also be making you feel anxious. So please be assured that we are pausing shielding now because we do believe it is safe to do so. However, if circumstances change, our advice will also change. We will continue to put your safety first. It's really hard for those of us who haven't been shielding, I think, to fully comprehend how hard the last few months have been for those of you who have. So I want you to know how deeply grateful I am to all of you for your patience and sacrifice. By following the advice, you have protected yourselves, reassured your loved ones and helped our health and care services immensely. Thank you to each and every one of you for that. Presiding Officer, the other major change I can confirm today relates to schools. It is a moral and educational imperative that we get children back to school as soon as is safely possible. In fact, a key reason for our cautious approach to lockdown easing over the past 2 months and indeed over the next few weeks is that determination to drive the virus down as low as possible and keep prevalence low so that schools can reopen safely in August. I'm therefore very pleased to confirm today that schools will return from the 11th of August. Given how long children have been out of school, some local authorities may opt for a phased return over the first few days, but we expect all pupils to be at school full-time from the 18th of August at the latest. Now, I realise the earlier confirmation of this would have provided more certainty for schools and for parents to get ready for the new term, but we had to be sure, very sure, that the latest evidence supported this decision. Last Friday, the Education Recovery Group agreed guidance to support the safe return of schools. That guidance, which is being published today, draws on scientific advice from our advisory group on education and children's issues. The guidance makes clear that, in general, physical distancing between pupils will not be required while on the school estate, although distance should be maintained between pupils in secondary schools where possible, provided this does not compromise the return to full-time schooling. Distancing should also be maintained between staff members and between staff and pupils. The guidance also sets out the risk mitigation measures that must be introduced in all educational settings. These include ventilation, good hygiene practices and improved cleaning regimes. It is absolutely vital for the safe reopening of schools that these measures are applied rigorously in all settings. In addition, important public health measures will also be in place for schools. These include test and protect and fast priority access to testing for any symptomatic staff and pupils. We will also establish an enhanced surveillance programme in schools which will allow us to identify any impact of the virus on pupils and staff in schools across the country. I can also confirm today, Presiding Officer, that in addition to £45 million previously announced, we will make a further £30 million available to support the recruitment of additional teachers. We anticipate that this total investment of £75 million will enable the recruitment of around 1,400 extra teachers. In addition, we will invest a further £30 million on top of £20 million already announced as part of a £50 million education recovery fund for local authorities. This will support extra cleaning, facilities management, school transport and other practical measures that are absolutely vital in ensuring a safe return to schools. Now, I must be clear, and I want to emphasise this point, that at this stage, no one, not me, not the Education Secretary, no one can absolutely rule out the possible need for blended learning arrangements in future, either at national level or locally, if there is a significant increase in the incidence and prevalence of COVID. But the current low prevalence of the virus, together with all of the safety measures that we are putting in place, give us as good a basis as we could have hoped for to get children back to school in August. I want to take the opportunity again today to thank children and young people for the way you have coped with this considerable disruption to your lives. I think I speak for the whole country when I say we could not be prouder of you, and I promise we will do everything we can to get things back on track for you as quickly as possible. I'm sure none of you will ever forget COVID, but we are absolutely determined to make sure that you will not bear the legacy of it later in your lives. Finally, on education, Presiding Officer, I can confirm that we are also today publishing updated guidance for childcare providers. This new guidance will come into effect from the 10th of August. Now, this new guidance doesn't represent a return to complete normality for childcare providers, but it does reduce the current restrictions while setting out age-appropriate measures to minimise risks for staff, children and families and wider communities. We know the importance to families of stable childcare, and these changes will help to make that more accessible. I'm sure the two main changes we are confirming today, a pause to shielding and the full-time reopening of schools, will be welcomed by people across the country. They are significant steps back to a less restricted way of life, and of course they also support a return to greater normality for the economy. But these changes have been made possible only because prevalence of COVID is currently so low in Scotland. In fact, in many ways, Scotland is in a better position now in relation to COVID than I would have dared hope a few weeks ago. But as I have said already, this position is very fragile. We've seen a slightly higher level of new cases in Scotland in recent days, although some fluctuation is to be expected. And we are seeing clusters and outbreaks, as we are experiencing in Greater Glasgow and Clyde right now, although again this is to be expected. But the situation around the world and across Europe and even in England does give some cause for concern. And we know from our own experience in late February and early March just how rapidly this virus can take hold and run out of control. So the fact is that if we are not very careful now, then in 2 or 3 weeks' time, we could easily be facing here in Scotland some of the very difficult issues we're currently hearing about in the news from other parts of the world. And it's also the case that we cannot yet fully assess the impact of the changes that have been made over the past 3 weeks, really significant changes such as the opening of tourism and the opening of indoor hospitality. And of course, we must, and this is really important, we must allow some time for the impact of reopening schools to be assessed before we make further major changes. For that reason, only a small number of further changes are planned during the next 3 weeks, and I will now confirm what these are. From Monday, routine eye care services, including regular eye examinations, can be carried out in community optometry premises and, where necessary and appropriate, in people's homes. Counselling services, such as drug and alcohol support groups, will be able to provide essential services following relevant guidance and with physical distancing. In addition, sports coaches will be able to meet with groups of more than 4 households in a single day, and we will also shortly confirm when they can work with larger groups. And from the 17th of August, a wider range of dental care can resume. In particular, aerosol procedures which create a fine mist through use of a high-speed drill will be allowed to restart if they are necessary for urgent dental care. These are the only changes that we currently expect to make during the next 3-week period. However, I now want to provide some indicative dates for late August and September to help businesses to plan. Full detail of this will be available on the Scottish Government website. However, please remember that at this stage, these dates are indicative and they remain subject to change. From the 24th of August, we hope that live events like concerts and comedy will be allowed outdoors with physical distancing, enhanced hygiene and restricted numbers. We also hope that organised outdoor contact sports will resume for people of all ages. Also from 24th August, we hope that some other indoor facilities such as bingo halls and similar venues mentioned in the route map can reopen with physical distancing. We would also intend that fun fairs and travelling fun fairs can reopen from the 24th of August. And we hope that driving lessons will resume from that day too. We don't currently expect to implement any other changes before the 11th of September. We will, of course, keep this under close review and accelerate further changes if that proves to be possible. However, as of now, non-essential offices and call centres should expect to remain closed until at least the 14th of September and possibly later. Even then, working from home and working flexibly will remain the default position. I know many office workers may miss seeing colleagues, although I suspect some might not, but by staying at home, office workers and employers are playing a vital role in helping suppress this virus and ensuring our transport network remains safe. We hope that further changes will be possible from the 14th of September. Again, full detail will be available on the Scottish Government website, but I must stress again that the dates I am about to set out are indicative and will not be finally confirmed until nearer the time. For example, we hope that sports stadia will be able to reopen from that day with limited numbers of spectators, albeit with physical distancing in place. Some professional sports events may be arranged for spectators before then, with Scottish Government agreement to test the safety of any new arrangements. We also hope that indoor sports courts for some activities can reopen from 14 September with physical distancing, and we will consider whether indoor classes for children can resume earlier than that. And it is our intention that indoor soft play facilities will also reopen from the 14th of September. Let me at this point make particular mention of gyms and swimming pools. I absolutely understand and share the desire to see these facilities open again as quickly as possible. However, the clinical advice I have is that because of the nature of these environments, they do pose a particular risk and they require a particularly cautious approach. For that reason, but to try to give some additional clarity, the indicative date we are giving today for reopening is the 14th of September. However, I will review this again in 3 weeks, and if it is judged reasonable to do so, we will seek to accelerate this to the end of August. We hope that entertainment sites and cultural venues such as theatres and live music venues will also reopen from 14th September with physical distancing in place. I know that the challenges these decisions pose for the cultural sector are significant and that this further delay for arts venues will be disappointing. For that reason, we're increasing the value of our Performing Arts Venue Relief Fund, which opens for applications today, from £10 million to £12.5 million to provide further support for the culture sector. More generally, Presiding Officer, I'm acutely aware, standing here right now, that in a statement like this, with a lot of ground to cover, I inevitably make a lot of 5-second references that have profound implications for businesses and livelihoods. So please believe me when I say that I fully recognise the impact of the decisions we are taking. I know how difficult this situation is for those sectors and activities that are facing a long wait before they can resume. We do not take any of these decisions lightly. But at present, we are not confident that we can restart all of these activities safely within a shorter timescale. Doing so could risk a resurgence in the virus and undermine our ability to get children back to school. Presiding Officer, today's statement is a cautious one, but given the nature of what we are dealing with, caution does remain essential. We want to open up society and the economy as quickly as we safely can. But we do not want to have to reimpose restrictions because the virus has taken off again or shut down sectors that have already reopened. That start-stop pattern can be seen in other countries already, and in my view, it is potentially more harmful to the economy in the medium to long term than a more careful and slightly slower approach to reopening now. As ever, the key factor over the coming weeks in determining our pace of recovery will be our ability to keep this virus at very low levels. And as ever, although government clearly has the central role to play, this depends on each and every one of us. So I want to end today by reminding everyone again of the vital importance of facts. These are the 5 golden rules that will help us stay safe even as life gets back to something closer to normality. Face coverings should be worn in enclosed spaces, at public transport, shops and anywhere else that physical distancing is more difficult. Avoid crowded areas, outdoors as well as indoors. Clean your hands regularly and thoroughly and clean hard surfaces after touching them. 2 metres distancing remains our clear advice. Self-isolate and book a test immediately if you have symptoms of COVID. And these are to remind people a new cough, a fever or a loss of or change in your sense of taste or smell. You can book a test at nhsinform.scot or by phoning 0800 028 2816. It is because so many people have done the right thing so far that we are able to pause shielding and reopen schools. So please, my appeal to everybody across the country is this: do not drop your guard now. Every single time one of us breaches one of these golden rules, we give this virus a chance to spread again. If we allow complacency to creep in now, it will be deadly, and that is not an exaggeration. So instead, I am asking everyone today to make a conscious effort to tighten up our compliance with all of these basic but life-saving measures. These are the best ways for all of us to protect ourselves, take care of each other, show our support for the National Health Service and ultimately, Presiding Officer, to save lives. Thank you.
Thank you very much. The First Minister will now take questions. Jackson Carlo.
Thank you, Presiding Officer. After months of gloom, I hope you'll forgive me if I start off with the unalloyed pleasure of those of us on this side of the chamber, at least, that after a year away but now fully restored to good health, John Scott has returned to the chamber. And Ayre's voice will now be heard again. And can I thank the First Minister for advance sight of her statement. For those services and groups who can now envisage a return, it will be welcome news that there is some prospect of normality. But I do want to emphasise as well, as the First Minister, the importance of none of us becoming complacent. There is no vaccine. This virus remains. It is not our friend. And although there is a temptation to abide by all the rules and guidance the first time you go to a restaurant or the first time you visit somewhere, after that there's a temptation to think, I can ease off now. Please don't. It's important that we all abide by the guidance and the rules. And for parents, pupils and staff, the reopening of schools, of course, is welcome, although it shouldn't have taken so much pressure from parents and opposition parties to make reopening in mid-August Scotland's Plan A. However, this morning there are reports that only half of councils are preparing for a full return in 12 days' time, so there's still some confusion. The First Minister said she expects schools to be back full-time on August the 11th, and she said that is the intention. But what she hasn't confirmed yet is how many councils will actually see that they do. Now, we've heard from a number of councils already that the funding they believe they will receive may be less than half of what is required, but today's announcement will at least help clarify some of that. But will the First Minister confirm specifically how many of Scotland's schools will actually open, offering full-time education on the 11th of August?
First Minister.
Can I try and... Well, sorry, President Officer, before I do that, can I also take the opportunity to welcome John Scott back to the Chamber? John Scott is a political opponent, I have to say a rigorous and respected political opponent, but I've always considered him a friend, and personally I couldn't be more delighted to see him back with us today. Let me just try to set this out very clearly. Schools will return on the 11th of August. My understanding is that most councils are planning full-time education from the 12th of August, but some will be planning a more phased return. Let's not forget that children have been out of school for 4 months. So for some children who haven't been inside a school building or seen their friends or their teachers for that period of time, perhaps a slightly softer start for the first few days may not be inappropriate. And I think it is right and proper that local authorities have some flexibility around that. And as I understand it, the local authorities that are planning that kind of phased return over the first few days include Tory-run councils. So this is something that councils will be looking at carefully, and I trust them to make that judgment. But we are expecting, and the Deputy First Minister will issue an education continuity order to this effect, that by the 18th of August, at the latest, all schools will be back full-time, because that allows for a slight phasing, but makes sure there is certainty about the full-time return. But I would expect the majority of councils will return to full-time education before that. So I hope that gives clarity to teachers, to local authorities, to parents, and most of all to children, who I know right now will be feeling excited about getting back to school, but probably a little bit apprehensive as well. And they should know that we're all thinking of them as they make that return.
Jackson Colin.
Well, I appreciate that the moment has been coming for weeks, and I am surprised we're not able to give absolute clarity, but that figure of date of the 18th of August is one that will be welcome, that all children will be back at school on that date. The First Minister concluded her statement by reminding everybody of the importance of facts. When Parliament last met on the 9th of July, and in response to questions from me, the First Minister repeatedly said that the prevalence rate of the coronavirus was 5 times lower in Scotland than elsewhere in the UK. Subsequently, this figure was widely reported and repeated in the media. This morning, the Director General for Regulation at the UK Statistics Authority wrote to us, and I know to the Scottish Government as well, giving his verdict on whether that statistic was true. And his verdict is damning. Firstly, when challenged at the time, the Scottish Government said it compared their Scottish Government COVID-19 modelling to a survey statistic for England. But when the UK Statistics Authority investigated and asked for the source of this statistic, the Scottish Government changed its story and said it was something else entirely. It was now a figure from a London university for the whole UK. Why did the Scottish Government mislead the public about the source of this claim?
First Minister.
I don't think that is the case, and let me say I stand by the view, which I think is backed up by the evidence, that prevalence of the virus is significantly lower in Scotland right now than in England. although this is not something I have a shred of complacency about. The issue with the statistic I cited before was that the UK English part of that statistic has not been published, and that is not down to me. The UK government hasn't published it, and I would encourage them, and perhaps Jackson Carlow will join me in encouraging them to do so. But if we look, and again, let me say here, my focus is on making sure that we keep this virus under control in Scotland, and I don't want to sound in any way as if I am complacent about that. But if we look at the number of people who have died over this month until now, for example, and every single death is a tragedy, in England, reported deaths under the daily measurement are around 2,000. In Scotland, they are 9. So again, I think that backs up the fact that there is a significantly lower prevalence and incidence of the virus in Scotland right now, and that is because of the elimination strategy that we're pursuing and the very cautious approach to coming out of lockdown. I am trying, as we speak, I'm trying to persuade the UK government and to join us in that express objective of eliminating the virus, and I hope we will get common ground on that. So we are making really good progress in Scotland. That's not down to me or the government, that's down to the sacrifices of everybody across the country. Our objective and our challenge now, as things become more volatile across the world, is to do all the things required to protect that progress, and that's what I am very focused on.
Jackson Carlow.
Well, I'm afraid that's not what the UK Statistics Authority had to say. Here's what they said. The sources provided with do not allow for a meaningful comparison to be made. But that is exactly what the First Minister did. So it's unacceptable that the First Minister is now trying to downplay this, because the importance is clear. This isn't just a number. This isn't some statistical pedantry. This was the centrepiece of policy used to justify major decisions just 3 weeks ago. Ministers used it to explain the timing of lockdown being eased. When the Scottish tourism industry was crying out for a positive message, the First Minister refused to shut down the idea of closing the border, using that prevalence statistic as the basis. Nicola Sturgeon used this prevalence figure to suggest her policy was working better compared to elsewhere in the UK. Here's what the UK Statistics Authority say.
Order, please. Let's hear Mr Carlow's questions. Order, please.
Here is what the UK Statistics Authority say. We do not think that the sources above allow for a quantified and uncaveated comparison of the kind that was made. Will the First Minister give us a straight admission? She made a comparison which she may have chosen to believe that was not true.
First Minister.
I accept the figures weren't published, and I accept the views of the statistics regulator on that. But I'd make, I suppose, a few points, and I don't know, I do deeply regret the sort of, instead of focusing on the substance of the issues we're all dealing with here, this attempt to somehow pretend that Scotland hasn't made the progress that we self-evidently have made in the fight of this virus is bizarre. We should all be so deeply grateful and relieved, I know I am, that we're seeing this virus driven to the low levels that we are seeing now in Scotland, although none of us should be complacent about that. And, you know, I quoted figures, and the figures I'm about to quote, just for Jackson Carlow's assurance, you can go onto the UK government's coronavirus dashboard and find these statistics. They are updated every day. In this month so far, around, I don't have the precise figure in front of me right now, but around 2,000 deaths in England have been reported under the daily measurement. These are people with confirmed cases of coronavirus. The corresponding figure in Scotland is 9. We have about 8.2% of the population. So I don't know whether Jackson Carlow is really saying that he doesn't himself think that there is a significantly lower prevalence of the virus in Scotland right now than elsewhere. You can see it in the daily case numbers that are reported as well. So I may have used a statistic that wasn't published, and you know, the statistics regulator rightly and properly has made his views known on that, and I respect that. But for goodness sake, there is plenty other published measures that lead to the same conclusion. And why would anybody want to deny that instead of saying we're really glad that Scotland is now in this stronger position? And I make no apology, Presiding Officer, for having taken the decisions that have led us to this position with all the sacrifices that people have made, and I will still take the decisions designed to get this country as safely as I possibly can through this crisis, whatever politics Jackson Carlow might want to play.
Jackson Carlow.
I think the First Minister has to be very careful when she talks about playing politics. When she is the leader and the chief executive of her party profiteer from COVID virus by producing party political face masks to raise funds for the SNP, and then encourage people down on the borders to shout obscenities at people coming to this country from England. Encouraged by...
Order, please.
Encouraged by SNP elected parliamentarians. And the issue here is that public confidence in government decisions should not be undermined by made-up figures to substantiate political party spin. Now, I'm perplexed because the binder in front of the First Minister is full of detail. The First Minister is well prepared. She is the first to bring a statistic to any debate. She made this claim about the prevalence rate 7 times, and again as recently as last week. This wasn't a slip of the tongue. It's not simply not for the First Minister to say she thinks this is all fine, nor to say that this is all very complicated and she has to try and imagine what the numbers were, nor to suggest that the UK Statistics Authority has been anything other than damning. The First Minister knows this prevalence statistic was wrong, and she knows why it was wrong. Now, people across the country take the First Minister at her word, and now we know that they were repeatedly misled on this fact. Will she apologise?
First Minister.
I genuinely find myself right now feeling quite sorry for Jackson Carlow. I've been a politician for 30 years, and I still can't imagine getting so bound up in bitter partisan politics that I can't bring myself to welcome the fact that we have made such progress against a deadly virus. How blinded must you be to find yourself in that position? And my tolerance for this kind of politics is lower than it has ever been before. Let me just, the conclusion I drew about the relative prevalence was not wrong. The figures I accept were not published, and that is not down to me, it's down to decisions of the UK government. But again, I come back to, we're in a position right now that over the course of July, we have had 9 registered deaths under the daily measurement in Scotland, none for the last 2 weeks at all. And the corresponding figure in England is around 2,000. So even if you think the figure I used previously was wrong, you're entitled to think that. The figures now demonstrate the relative position. And why would anybody try to gainsay that? Why would anybody find pleasure in arguing that that is not the case? I've had to stand up day in and day out and report these death figures. The relief I feel every day when I'm able to report no deaths because of the reducing prevalence, because of the reducing incidence, because people across this country are doing the right things is immense. And I'm going to continue to focus on that. Yes, I will continue to do everything to persuade people to wear face coverings. And in terms of my party, every penny of profit made will go to charity, actually. Yeah. But I will do everything possible to encourage people to abide by all of the advice, because that's what's got us into this position. Jackson Carlow, for his own narrow reasons, might not want to recognise the strong position Scotland has got itself into, but I'm afraid it is a reality. And the focus now and the challenge for all of us is to make sure we continue that reality and don't go backwards. And that's what I'm going to continue to spend every waking moment of my life concentrating on.
Richard Leonard.
Thank you, Presiding Officer. And can I also thank the First Minister for advance sight of her statement, and can I agree with her that we need to take a cautious approach going forward. And that need for caution is true when it comes to our schools as well. And we look forward to seeing more detail on risk assessments and action to be taken to keep everyone safe as they return to the classroom. Let me deal with the substance of another issue. To save lives in the future, we must also learn from the past, including from the immediate past. So the powerful testimonies in BBC Scotland's disclosure programme this week on Scotland's care home scandal from residents, families and frontline carers must be listened to. We heard from June, a frontline carer in a nursing home who said, and I quote, "There was no testing of staff in our care home until the middle of June. What chance did we really have of keeping COVID out? Dozens of us came down with it, and more than 30 of our residents have died. Just yesterday, an internal Scottish Government document released under Freedom of Information legislation of minutes of the Cabinet on the 18th of February revealed that the Scottish Government's planning, I quote, included work to assess the vulnerability of the social care sector. Yet for all the talk of that planning, staff on the front line in social care did not have the PPE they needed when they needed it and were not routinely tested until 4 months later. So what chance did they have, First Minister?
First Minister.
Well, Richard Leonard is raising really important and substantive issues, and I thank him for that. They're not easy issues, and they're issues that I and the Scottish Government spend a lot of time considering, scrutinising and learning lessons for the future. On care homes, the Cabinet, I haven't seen the particular document that you're referring to, but if it refers to a Cabinet discussion talking about taking steps to help protect the social care sector, then that reflects the fact that that is exactly what we were seeking to do. And issues around testing were clinically driven and advised, and of course we will look back and we will consider all of the decisions we took and make sure that if there are lessons to be learned, we do learn them. We took significant early steps to supplement the supplies that care home providers have themselves for PPE through additional routes, and we created additional distribution routes for that as well. So we have taken a number of steps. We put in place guidance around infection prevention and control within care homes, and also people being discharged from hospitals into care homes. Clinical risk assessments were done. So I absolutely do not counter or challenge the fact that if we were to go back now, we may do things differently based on what we know. And I'm never going to stand here and say that it's not possible that mistakes were made. I think it's really important that all of us are open about that. But I will always counter and push back against the fact that we didn't take care and we didn't do the things we thought were right in good faith at the time. And I deeply regret every death from coronavirus, and in particular because of the frailty and vulnerability of the people we're talking about, deaths in care homes. I feel even more deeply, as I'm sure all of us do, and we already are in government reviewing all aspects of our COVID planning, including the decisions that were taken in care homes, in order that we can learn any lessons for what could be challenging months ahead, although of course we hope that that will not happen.
Richard Leonard.
Thank you. And the First Minister once again is really talking about hindsight, but that doesn't change the facts. And it's a matter of public record that back on the 12th of March, 11 days prior to lockdown, I raised concerns with the First Minister about social care. On the 19th of March and then on the 1st and 9th of April, I raised the need for testing and concerns about the shortage of PPE. On the 16th of April and throughout the whole of May, I asked the First Minister repeatedly for more action on care homes. And First Minister, even if you did not want to listen to me back then, why didn't you listen to frontline carers, to professional associations, to royal colleges and to trade unions raising concerns? Why didn't you listen to people like Donald McCaskill, like Alison Pollock, like Hugh Pennington? And if you did not want to listen to them, why didn't you act? Why didn't you act on the recommendations of your own planning exercises? Exercise Iris, Silver Swan, which warned of unpreparedness in social care in the face of a virus in 2015 and 2018. 65% of Scotland's care homes have now had COVID-19. Half of all deaths from COVID-19 have occurred in Scotland's care homes. There have been over 2,300 excess deaths in Scotland's care homes, and 13 care home workers have died from this virus. No wonder the Scottish Human Rights Commission says we need an inquiry which is prompt, which is independent, which determines responsibility, is subject to public scrutiny and allows for the involvement of the next of kin. One which considers whether human rights standards and principles have been met in Scotland's care homes. I agree that this is exactly what must happen. First Minister, will you commit today to a human rights-based approach to any public inquiry into the scandal in Scotland's care homes?
First Minister.
I have already given a commitment that there will be a public inquiry into COVID, including the situation in care homes. I will be corrected if I'm wrong about this, but I think in their recent report, the Scottish Human Rights Commission actually welcomed the commitment that I've given to an inquiry into this, and human rights should be absolutely the centre of all we do now and in the future, but should also be at the centre of any look back to what has happened up until now. Richard Leonard has raised these issues consistently, and I give him due credit for that, and others have raised issues as well, and we have... I think the thing I would say to Richard Leonard in all sincerity is that in some cases we may have come to a slightly different conclusion, we may have done things in a different order or in a different timescale than Richard Leonard may have asked us to do. That does not equate to not listening. As government we have to and do listen to a wide range of opinion, clinical opinion, as well as frontline opinion and a range of expert advice, and then we have to make judgments about the best way forward. And at every stage we have sought to put the well-being, the health and the safety of care home residents and staff at the heart of what we do. I readily accept that in two categories. One, because unfortunately we can only look back with the knowledge that we have now, and some of that knowledge we didn't have at the time, and therefore different decisions may well have been taken. And in another category, and you know, this is not usual for a politician to stand here and so readily do, but I think it's important that we do it. Undoubtedly, this government, all governments will have made mistakes in all parts of handling of this, and we have to acknowledge that and accept the accountability for that and learn for the future. And I am absolutely committed to doing that. And the reason I'm committed to doing that is not just, although this is important, for the sake of those who have died and their families, or those who contracted COVID in our care homes, but it is also for the future. I was reading a report this morning in the media about the situation in Victoria in Australia right now, where they're having a surge of cases, and a significant number of those cases now are also in care homes. So this is something that has not gone away for any country across the world, and for that reason, as well as all the others, the need to learn lessons is important, and I am absolutely committed to doing that. And I welcome, as I have throughout, I welcome the input from people across the chamber on that.
Richard Leonard.
Thank you, Presiding Officer. Well, the First Minister mentions the Scottish Human Rights Commission, and let me just be clear about what it is that they said 2 weeks ago. They did say that they welcomed the First Minister's commitment to holding a public inquiry into the handling of the pandemic, including what has happened in care homes. But they went on to say, we would now like to see the Scottish Government further commit to taking a human rights-based approach to any public inquiry. And that's the question which I just asked the First Minister, and I would be grateful if she could give me an answer to that question specifically. The strain of dealing with this pandemic has been traumatic for care home residents, families and frontline staff. They are traumatised, but they are also angry. Yvonne, a senior carer in a care home, told the Disclosure Programme this week, people were even blaming us for taking COVID into the homes, but we weren't being tested. 1 minute, they're saying to us, don't wear a mask. The next, wear a mask. We didn't know if we were coming or going. Now they are testing us, but thousands are dead. It's too little, too late. Too little, too late. So, First Minister, what we need now is compassion and action. These frontline carers are still living in fear. Fear that they are not supported by the Scottish Government. Fear that they will be written off again. Fear that they will go unrecognised, unappreciated and unrewarded now that the clapping has stopped. What action will you take to support them, to recognise and reward them, and to give them hope in place of that fear?
First Minister.
Firstly, I thought I had answered this question in my previous answer, but just in case I left any doubt, which clearly I did, let me repeat it. I am committed to a human rights-based approach to any inquiry. I think that should be taken as read, but for the avoidance of any doubt, let me put it on the record. Can I also say, I don't blame any care home worker. I absolutely do not blame any care home worker or any frontline health worker or anybody else for what has happened in coronavirus. On the contrary, I went into this crisis full of admiration for those who work in the front line of our health and care services, and 4 months later I cannot find the words to properly convey the admiration and gratitude and respect I have for them. So they have done an outstanding job in the most difficult of circumstances, and they will have my lifelong gratitude for that. But Richard Leonard is right. Gratitude is not enough. That is why we work. Donald McCaskill was mentioned earlier on. The Health Secretary works very closely with Donald McCaskill, who is Head of Scottish Care, and talked regularly to trade unions to make sure we are hearing concerns and acting on those. I'm not going to recap because I've done it previously and in the interest of time, but I can outline all of the different steps we've taken to respond to concerns, whether that's on PPE, on testing, on other aspects of the situation in care homes, and we will continue to do that. For as long as it takes, nothing will be more important to me and to the whole Scottish Government than getting the country, not just our care homes, but certainly they are particularly important, but the whole country as safely as possible through this pandemic. We're not there yet. There is still a lot to do, but the approach we are taking, the cautious approach to coming out of lockdown, and the steps we are taking to learn lessons and make sure that we have the right protections in place for future will remain absolutely at the heart of all of our thinking and all of our planning for as long as necessary.
Thank you. Patrick Harvey.
Thank you, Presiding Officer. Can I also thank the First Minister for the advance copy of the statement and join with others in once again thanking everybody in every public service, in every business and every individual in Scotland who continues to take this situation seriously, observe the rules, listen to the guidance and treat this pandemic with the seriousness that it deserves. In preparing to open schools, the First Minister's statement placed some emphasis on the importance of testing. Test and protect, access to fast-track access to testing for symptomatic staff and pupils, and also an enhanced surveillance testing programme for schools. Now, these measures are going to be absolutely vital if we are to rapidly identify and contain any new outbreaks. So I imagine I wasn't the only person this week who was a bit disturbed to hear the Deputy First Minister say on Monday that the enhanced surveillance testing might not in fact be in place by the time schools reopen. Nobody here wants to see any new outbreak in schools, as has happened in other countries. So can the First Minister now give us a clear assurance that the enhanced surveillance testing regime for schools will be in place, fully operational, by the 11th of August?
First Minister.
Can I thank Patrick Harvey for his question and also for highlighting the importance of test and protect in schools. There will be the availability, priority, fast access to testing for any young person or teacher who has COVID symptoms, and that is an important part of the protections and reassurance that we want to give. On the issue of surveillance, I absolutely understand the question Patrick Harvey is posing, and I want to try and give as much clarity as possible. There are different aspects to an enhanced surveillance approach, as there is for our general surveillance approach, and aspects of this will be in place as schools go back. Other parts of it, including testing on a sample basis, will come into effect over the coming weeks. So initially in enhanced surveillance, we will look closely at other data that we have available for local areas that give us an indication of any issues for concern in schools, and then that will be supplemented over the next period with sample-based testing of young people and teachers who are not symptomatic, and that will jointly combine over the weeks to come in this enhanced targeted surveillance programme that will allow us to assess whether there are particular issues of concern in schools in any part of the country that need additional action, and the Deputy First Minister will be very happy to keep the Chamber updated on that. Patrick Harvey.
I appreciate that none of this can be done with the click of a finger or the wave of a magic wand. This is important to get right. But I I'm afraid I do have a concern that feels as though we're about to repeat the same experience that we had in debating the role of testing in the social care sector, where it did take a long time to persuade the government not only to put testing capacity in place, but ultimately to roll out routine, regular testing. Not just surveillance testing, but routine, regular testing. And we're going to have to do this if we're serious about keeping our schools safe for the long term. There is now routine testing in place for care workers. In other parts of the economy, not the government's responsibility, even footballers in some cases are being tested as often as 4 times a week. We all want to prevent new outbreaks, as happened recently in Israel, for example, where a major school outbreak began just days after schools reopened. That would threaten our ability to continue to keep schools open for the long term, as well as putting people directly at risk. It would be unacceptable if anyone said that teachers should feel less secure going to work than footballers. So why does the First Minister believe it's not necessary to offer routine, regular testing to teachers and other school staff?
First Minister.
Can I say, just as a preface to my answer here, I'd be happy for party leaders or others who have an interest to perhaps arrange a briefing with the Chief Medical Officer and others to maybe go into a bit more detail about some of the clinical issues that drive our testing strategy, particularly at times when community prevalence is as low as it is now. Because I find myself speaking about these things often, but of course I'm not qualified to go into all of the technical details. So if there is an interest in that, I'm happy to make those arrangements. We do take these issues in schools very seriously. Let me be very clear about the importance of test and protect in schools, and that means any person who has symptoms has access to testing quickly, and then of course any contacts of anybody that tests positive are traced as well, and that is an important assurance. It's really important. Patrick Harvey mentioned Israel, and I know the advisory group that gives us advice on these things has looked at the experience in other countries, including the situation in Israel. Often what you find there is it's not outbreaks in schools that drive community transmission, it's community transmission that then risks outbreaks in schools. So the key thing we have to do to protect schools is to keep community transmission as low as possible. But surveillance generally is part of that, but surveillance in schools also gives us added assurance, and that is a mixture of looking at the kind of data that we have. We are trying to develop a suite of data that gives us as early an indication of any emerging problem as possible, and we will use that to look at schools, and of course that will be supplemented by the testing on a sample basis that I have already spoken about. So there is a lot of thought and a lot of clinical advice going into the system that we will put in place for schools, and if the evidence says that we need to adapt that in the future, we will do that as well. But I'll end this answer where I started. If members would find it helpful to have more of a briefing from the specialists in this area, I'd be happy to make those arrangements.
Thank you. Willie Rennie.
Within the next few weeks, up to 50,000 international students will be travelling to Scottish universities. It will probably be the biggest single influx of people into the country since the start of the pandemic. International students are important for our world-class universities, and they are welcome here. But they will be arriving from virus hotspots, including the United States of America. And students, staff and local communities are anxious about potential outbreaks. They will be required to quarantine for 14 days, but I want to go further to keep people safe. One of the First Minister's advisors, Devi Shridhar, is now recommending mass testing of all students on arrival and 5 days later. Does the First Minister agree?
First Minister.
Well, two things. I agree that this is a really important issue. It's one that's certainly very high up in my mind at the moment, and we are in discussions with universities about how we do get to a position where we welcome international students that are very important for Scotland, but do that safely without raising the risk of importation of the virus, because importation of the virus is probably the biggest risk we face over the immediate term. I have seen Professor Shridhar's recommendations. She obviously is one of the advisors to the government, and we will consider those very carefully. We haven't reached a final conclusion with universities on those yet, but I am happy, or the Deputy First Minister will be happy over the next few days to provide an update once we've had the opportunity to properly consider those and come to a final position.
Willie Rennie.
The First Minister has just warned in her statement earlier that we could be facing a rise in cases in 2 to 3 weeks' time. That's exactly when the students will be arriving here in Scotland too. So it's very important that we get this right so we can keep everyone safe, including those international students. And it's good the First Minister is open-minded, but if we are to do that mass testing, we'll need to act fast, because we've only got a few weeks left. Universities have been planning for months, following the detailed government guidance, but none of them are ready to mass test all international students twice in a week. The First Minister regretted not testing all new residents in care homes. I don't want the same mistake to be made again. So can I ask her to listen to her own advisor, Devi Schroeder, and make it happen?
I think anybody that looks objectively at my decisions over the last few weeks will probably reach a conclusion. I listen very carefully to Devi Schroeder, and I'm very influenced by the very wise advice that she gives us. On these issues, so I agree with the points that Willie Rennie is making. I'm simply, I suppose, in return, making the point that these things, although I know and reflects the discussion I often have with my own advisors, these things are really as straightforward and simple as they appear on the face of it. So testing may well be an important part of this, and I certainly want to consider that fully and to do so quickly. But Willie Rennie talked in his first question, I think, about the requirement there will be to quarantine, and this is similar to the position with international travel more generally. That is actually the most important piece of advice that we give. And there's a debate within the UK government right now, and certainly we will continue to explore these things as well, as to whether quarantine, whether there is an alternative to quarantine around testing, either a full alternative or partial. And I am open-minded to that. And this is where I have always said, and yes, we have changed our position on testing in line with clinical advice, but actually one of the points I have always made, which I continue to make, is that testing is not a magic solution, because the incubation period of this virus means that if somebody comes into the country, you test them on day 1 and they're negative, and even if you test them on day 5 and they're negative, that does not mean that by day 6, 7, 8, 9, 10 through to 14, they will not test positive. So testing may well have a part to play, but it is unlikely to be an alternative to the quarantine, which is the foundational bit of advice we're giving people. And I think it's really important for all of us to remember that. This is not about saying to international students they just come into the country and nothing happens. The quarantine advice is the vital bit of advice, and if there are ways we can supplement that, that's what we're considering.
Thank you. We're going to move on to open up to questions from all members. We're going to run the question session up to 2 o'clock, but there are a large number of members who wish to ask a question. Those who haven't already done so, if you wish to ask a question, email the business team rather than use your request buttons. Stuart McMillan, to be followed by Donald Cameron. Stuart McMillan.
Thank you very much, Presiding Officer. I thank the First Minister for the update about the cluster in my constituency, including Port Glasgow, and I'm aware that the Health Board will be issuing a further statement today. That the lack of information provided thus far has understandably caused concern amongst my constituents, and I also realise that speculating about the events won't assist the situation. But can the First Minister confirm that it's both the M&D Green pharmacies in town, what assurances can be provided that M&D Green followed all the correct COVID-19 procedures, and what additional testing will be put in place in my constituency to help my community?
First Minister.
Can I thank Stuart McMillan for his question, and can I thank him for his very close interest in this over the past 24 hours or so on behalf of his constituents. I appreciate, and public health teams across the country and my own officials will tell you that they often have me demanding more information and more answers as quickly as possible on these things. But these outbreaks are often very complex, and they do take time for contact tracers and public health experts to understand what the links are and what the possible routes of transmission are. So I would appeal to people, we're all highly anxious about this, but I would appeal to members in particular to have a bit of patience as the experts do their job and work to minimise onward transmission and protect all of us. Can I give Stuart McMillan the assurance that the 2 locations, the pharmacy in Port Glasgow and the Amazon facility in Gourock, have been visited by Environmental Health. The arrangements that have been in place there to mitigate risks have been looked at, where appropriate further advice has been given, and I am assured that both of these locations have cooperated fully and are taking all advice and following all of the appropriate guidelines that are being advised to them. The issue of testing is important. So there is testing underway as part of the contact tracing programme, and we will consider, guided of course by the incident management team, whether further testing through a mobile unit or some of the other facilities can be made available or need to be made available on a wider basis. And if that is required as part of the management of the outbreak, then that will be provided. And we will keep both Stuart McMillan and the wider chamber updated as and when there is more information and more decisions. The incident management team will meet again this afternoon, and I would expect a further statement to be issued once that has concluded.
Thank you, Donald Cameron, to be followed by Ian Gray.
Thank you. This week's harrowing BBC documentary about care homes showed care home workers who felt they were prevented from sending residents infected with COVID-19 to hospital. In March, the Scottish Government issued guidance that stated as follows: it is not advised that residents in long-term care are admitted to hospital for ongoing management but are managed within their current setting. Anyone reading that guidance would think that residents infected should be kept in their care home. In the light of evidence from care home workers, does the First Minister now accept that that guidance issued in March was wrong?
First Minister.
That guidance was not intended to in any way negate the clinical judgment of somebody caring for an older person. I've said in the chamber before, and I will say it again, it is not for politicians or civil servants to decide what happens to any individual who is unwell in terms of the clinical care of that person. It is for the clinician or clinicians looking after that person, and that is what has and should continue to guide the decisions on people in care homes, as it should guide the decisions of anybody else. That said, and I think that is what this guidance was perhaps trying to encapsulate, that often it will be better for an older person, perhaps in an advanced stage of their life, not to be admitted to hospital, because some of the treatments in hospital, particularly very intensive care treatment, would not be appropriate for an older person. Instead, it would be more appropriate for them to stay and be cared for in their own familiar environment. But ultimately, the decision about that must be based on individual circumstances and the clinical decision of those responsible for the care.
Ian Gray, to be followed by John Mason.
Thank you very much. It is welcome news that schools can return full-time. But whether it's full-time or blended learning, we've known for months that we would need more teachers, support staff and cleaners. Instead of giving councils the resources they needed when they needed them to get staff in place in time, the government was still haggling with COSLA last night. There's now only a fortnight to go to find these staff. It's still just over half the money needed. It's still just over half a teacher per school. It's still too much of a wing and a prayer. So will the First Minister commit now to whatever further resources schools need when they need them, so that they can be open and safe?
First Minister, before you reply, can I just ask Mr Swinney to stop heckling speakers when they're asking questions? First Minister.
Ingrid, comes out with statements that say it's only half of what is needed. I'm not sure exactly what he is basing that. Well, COSLA, and I say this with the greatest of respect, of course COSLA will want to maximise the resources that the Scottish Government makes available to them. And we have a negotiation, and we come to a view on the appropriate. Now, Ian Gray, and he's entitled to do this. He sort of criticises the government when we haven't announced new money. He criticises the government when we do announce new money. I've just announced significant extra investment, investment that will support the recruitment of 1,400 additional teachers across the country, a £50 million fund that will support local authorities with the extra cleaning, the facilities management, the measures they may have to be put in place in school transport. So Absolutely. You know, I used to do it in opposition and myself. I'm sure it is always possible to say it's not enough. But in times when we're all facing additional demands for financing, and at a time when the Scottish Government's budget is continues to be constrained, and we don't have the additional borrowing powers that we would like to have, the kind of money that I've talked about today is significant, and I'm sure local authorities will make very good use of it.
John Mason to be followed by Liam Kerr. John Mason.
Thank you, Presiding Officer. I think theatres and other performing arts venues have been very grateful for the support they've had so far, including my favourite theatre, which is the Tron in Glasgow. But I understand they will not now be able to reopen before the 14th of September. Can the First Minister clarify what extra support is being provided for them?
First Minister.
I've indicated today some additional support through our Performing Arts Venue Relief Fund. Applications open for that today. The original funding for that was £10 million. We're increasing that to £12.5 million. And I tried to convey this in my statement. I stand here and I announce these decisions, and often I do it in a sentence or two. And I know that behind every single one of these decisions are profound implications and consequences for individuals, businesses and whole sectors across the country. And I want people to know that they are not decisions that we are taking lightly. We are looking very carefully at the different environments and the different risks that are associated with these environments, and setting out a cautious path forward that is designed to make sure we keep moving forward, and that we don't get into a position where we're having to go backwards and close down venues or businesses that have previously been reopened. And we will continue to look at what support we can give to those who are having to wait longest, because I know how hard it is for them.
Liam Kerr, before Monica Lennon.
Thank you, Presiding Officer. Page 61 of Benny Higgins' report last month was clear that the Government should respond to his recommendations by the end of July. On the 24th of June in this chamber, the First Minister promised to do so. Today is the 30th of July. First Minister, will the timescale be met?
First Minister.
I know that Conservatives pay a lot of attention to my daily updates, so I'm sure they heard Fiona Hislop, I think last week, confirmed that the 4th of August will be, or early August I think she said, but the 4th of August will be the publication date for both the response to Benny Higgins' report, but we've also decided on that date so that we can combine it with the support of the strategic group around skills and employability. So I'm sure Liam Kerr will be looking forward eagerly to both of those submissions.
Monica Lennon to be followed by Emma Harper.
Thank you. Care homes remain the crisis within this crisis, and we should not forget that 12 care home residents have died from COVID-19 in the last 3 weeks alone. Despite this, data on staffing levels and deaths in individual care homes remains largely a secret. And referring back to BBC Disclosure, like other colleagues have done, we've heard that many care homes were on red or amber alert at the height of the pandemic. And my constituent, Louise McKechnie, managed to get her way into White House Care Home in East Kilbride. And the days before her grand eye, she found her lying in a soiled, wet bed with an open bin bag full of dressings and other infectious items. So people do have a right to know what's happening behind closed doors in care homes. First Minister, does the First Minister agree that informing the public about COVID deaths in individual care homes is in the public interest, and will she commit to a more transparent approach in future?
First Minister.
We publish a significant array of information, and that information has expanded and grown over the course of this pandemic. So I will always agree to consider whether there is more information that we can publish. I absolutely believe that it is vitally important that people understand the course this pandemic has taken, the consequences of it, in order that they can understand some of the decisions, and also understand if there are decisions that have been taken that should have been taken differently. So I will further consider that. I think the other thing I would say to Monica Lennon, relating to the early part of her question, and it is important when she said we should never forget, and I want to give her an assurance that for as long as I live, I will never forget any one of the deaths in care homes or across the country. I know people across this chamber, and this is right and proper and absolutely understandable and legitimate, will disagree with decisions I take, will think I should take decisions I don't, or think I shouldn't take decisions that I do. That is part and parcel of democracy. But I genuinely hope that nobody will doubt the sincerity and the determination that I and my colleagues across government have to make sure that we take the right decisions, we get this as right as we possibly can, and we protect people as far as we can from this virus. That has been our objective from day one, and it will be continue to be our objective for as long as this virus remains a risk to our health and well-being.
Emma Harper to be followed by Miles Briggs.
First Minister, since COVID restrictions have been eased, there's been a surge in reports of very irresponsible campers, who I call fly campers, leaving large amounts of litter, setting fires and causing real damage to the natural environment. These fly campers should not be confused with wild campers who live by the phrase, take only pictures and leave only footprints. Does the First Minister therefore agree with me that everyone who accesses the countryside needs to do so responsibly, and will she join me in encouraging all to familiarise themselves with the Scottish Outdoor Access Code?
First Minister.
Yes, I absolutely agree with that. Many people are enjoying the opportunity to get outdoors for the first time after some months spent by necessity very close to home. And the vast majority, and I think it's important not to lose sight of this point, the vast majority are doing so responsibly, and I thank them for that. But there is a small minority of people who are spoiling this for others. They're endangering themselves and communities and the environment, and behaviour like that is not acceptable, and I want to be absolutely clear about that. Community policing teams are taking these matters seriously, and they have powers under the Antisocial Behaviour Act to issue on-the-spot fines to people who are behaving in antisocial ways. We have also partnered with Zero Waste Scotland and Keep Scotland Beautiful to develop a national anti-littering campaign, which launched on the 15th of July, and we'll continue to work with local authorities and the police to consider what more can be done to protect our rural environment and communities across Scotland, as more of us take the opportunity of the freedoms that we've been denied for so long.
Miles Briggs, be followed by Colin Smith.
Thank you, Presiding Officer. The BBC Disclosure Scotland programme demonstrated how families across the country who have lost loved ones to COVID continue to seek answers. These individuals and families need support, assistance and the truth. So can I ask the First Minister if she will agree today for the Scottish Government to establish a COVID-19 families network and fund to help them to access advocacy services to get the answers they need?
In principle, yes, I'm happy to consider that. Obviously, I'd want to consider the detail and exactly what that would entail and what arrangements would need to be put in place to support it. But I'm very happy to consider it and feed back to the member when I've had an opportunity to do so.
Thank you. Colin Smith, be followed by Rona Mackay.
Thank you, Presiding Officer. Whatever the arguments over the handling of the lifting of the quarantine rules for travellers arriving from Spain, for them to be reintroduced a couple of days later, the reintroduction is a further blow to the civil aviation sector, a sector already on its knees, with the Fraser-Allander Institute projecting a possible 2,500 job losses in Scotland alone. So will the First Minister personally meet with the trade unions and other stakeholders to listen to their case for sector-specific support from the Scottish Government to minimise the jobs crisis facing Scotland's airports? And will she also ensure that all business support includes conditionality to stop the current practice of Scottish Government grants being paid to companies firing staff so they then can rehire the same staff on lower pay and conditions?
First Minister.
In relation to the two specific points, firstly about meeting the trade unions, I spoke personally to Pat Rafferty of Unite Union yesterday, or I think the day before yesterday, specifically about aerospace and aviation, and I will continue to have that engagement and dialogue, as my ministerial colleagues will, on a range of different issues. On the issue of grant support or other financial support from the Scottish Government, we always seek to embed fair work principles into those arrangements, and we will continue to look at what more we can do to do that, because I agree certainly with the sentiment of Colin Smith's question. On the wider issue, briefly, I think in some ways this encapsulates the difficult balancing act that we're trying to strike here. The impact on aviation and aerospace is significant, and that's why we want to try and, when the evidence says it's safe to do so, allow them to return to normality as much as possible. So when the evidence looked as if that was possible with incoming travel from Spain, we did that, but we also said at the time that that was subject to change should the picture alter again. And that really is the nub of this issue. We are living right now in an inherently unpredictable, uncertain and unstable situation. And that affects international travel just as it affects aspects of our life. And that means that I reserve the right, and the Scottish Government reserves the right, to take whatever decisions we need to take to protect the public. Because if we protect the public from this virus, then yes, I know that some of what we have to do to achieve that has a big impact on the economy in the immediate term. But by doing that, I think we give the economy in the medium to longer term a much better and more sustainable platform for recovery.
Rhoda Mackay to be followed by Rachel Hamilton.
Thank you, Presiding Officer. I very much welcome the announcement that vital drug and alcohol addiction services are able to restart safely. Can the First Minister confirm that venues such as church halls, etc., will be able to open to host them, and will guidance be produced?
First Minister.
So yes, this is dependent on the venues being able to be available for that, and it is also dependent on guidance being in place. Obviously, there are a range of different services encapsulated in this general position, but we want to see them able to operate as quickly as possible, and therefore we'll work with different parts to get that guidance in place as quickly as possible, because I know how important access to these services is for many people across Scotland, and that I think applies in particular to drug and alcohol counselling services.
Rachel Hamilton to be followed by Julian Martin.
Presiding Officer, may I draw members to my register of interests? The wedding industry in Scotland is worth £963 million and supports 14,000 businesses and 55,000 full and part-time jobs, some of whom wrote to me this week to say that jobs are at risk and the sector feels, and I quote, entirely forgotten. First Minister, if you say that Scotland is in a strong position and the prevalence of COVID-19 is reducing, will you give a guarantee, similar to the Northern Ireland Executive, that your government will work closer with the wedding industry to give them hope that their employees will hold on to their jobs and reassure them that they can salvage what is left of peak wedding season in Scotland to save their businesses?
First Minister.
It's a very important issue for many businesses across country. It's got a particular relevance and resonance in areas like Gretna for obvious reasons. So it's one that we are very mindful of. It featured in the Cabinet discussion earlier this week. It featured in the daily update that I gave to the media yesterday. Again, as with so many things, we have to strike the right balance. There are some different considerations around gatherings for weddings and funerals than there are to gatherings in some other contexts. But I hope over the next few weeks that we can look to increase the limits on people that can go to these kinds of occasions, and we will continue to look at what we can do to support any sector and businesses within those sectors that are affected. The Finance Secretary just yesterday announced some additional support for the hospitality sector. So none of these things are easy, and it is not possible for any of us to remove all of the impact of what we're dealing with right now, but we will continue to work as hard as we can to strike the right balances and to provide as much support as we possibly can.
Thank you. Gillian Martin to be followed by Anas Sarwar.
Thank you, Presiding Officer. It's clear that the test and protect system is key to our movement into the next phase and to some kind of normality. Can the First Minister confirm if the Scottish Government is having discussions with the Irish and Northern Irish governments in relation to their proximity apps for contact tracing?
First Minister.
Yes, we are looking at that. I can say to the Chamber today that work is underway and at quite an advanced stage for us to have a proximity tracing app available in Scotland in the autumn, using the same software as the Republic of Ireland app is using right now. I hope we'll be able to confirm more details of that over the next couple of days and update the Chamber in that way. I think it's important to say that proximity tracing apps, and I've said this all along, may be a useful enhancement to test and protect, but it is not and never will be a substitute for the on-the-ground, person-to-person approach to contact tracing. So we do want to see if we can get that enhancement in place. The Republic of Ireland app appears to have been very successful so far, which is why we're keen, as I believe Northern Ireland is also doing right now, to see if we can utilise that. Of course, we'll continue to have discussions with the UK Government as well about the development of their own technology.
And Sarwar to be followed by Fulton McGregor.
Presiding Officer, it's deeply regrettable that we've had a return, or at least part return, of party politics when we have tragedies in our care homes and we have the statistics published today that shows that Scotland has the third highest rate of excess deaths in Europe. Our fellow citizens have died, many of them, and lives are still at risk. Can I join the First Minister in paying tribute to all those that have been shielding, some 180,000 people across the country, thank them for their patience and their sacrifice. I believe stats today show around 4,000 of them have sadly lost their lives. And as shielding now ends, many of them will be even more anxious. Some of them will not have a choice. They will be forced to go back to work, depending on their relationship with their employer. Can I ask the First Minister what action there is available if there is unreasonable employers for those that are shielding? And secondly, if we do have local outbreaks and we do have local lockdowns, what immediate rapid communication mechanisms are in place to inform those that would need to shield in those circumstances, and then what support mechanism will be in place for them?
First Minister. To thank Anna Sarwar for his question. Can I just take a brief opportunity on the issue of politics around this? I'm not infallible on these things, and I will get it wrong at times as well. But can I make a refreshed plea to people across the chamber for all of us to try to keep normal party politics out of this? And that is not me asking not to be scrutinised. On the contrary, I think scrutiny is really, really important. And I know comments have been made about daily briefings and everything. If any of you think that I cross the line, because I try very hard to keep politics out of these things, because I want people listening to them to listen to the advice, whether they agree with my politics or passionately disagree with my politics. So if any day any of you think I've crossed the line there, because I make mistakes as well as anybody else, then, drop me a text, tell me that. But please do not try to undermine my ability to communicate directly with the public on key matters of public health during a global pandemic. And I welcome Anna Sarwar's comments. On the substantive question, we will continue to support people shielding to make the right decisions about going back to work. The guidance that I refer to is really important because it allows individual risk assessments to be done. And we will continue to have discussions with any employer that we are told are putting undue and inappropriate pressure on people who are shielding. And I think that's important. And I would ask employers to be responsible and to make sure that they continue to be very sensitive to the needs and the anxieties of people who have been in that category. On the issue about local lockdowns, the SMS text service that has been in place will remain in place, and we will continue to communicate to the shielding group through that. I indicated last week that there will be what we're calling a forecasting service made available, where people will get information about the prevalence of the virus in their local area so that they can make informed judgments about what they do and don't do. And obviously, depending on the nature and extent of any local lockdowns, we would look to discuss with local employers about what the implications of that are. But the need to communicate very clearly with people in the shielding category will not pause on Saturday, even although the advice to shield at this stage is pausing at that stage.
Fulton McGregor should be followed by Annie Wells.
Thank you, Presiding Officer. Like many people, I welcome fully the news today that schools will be reopening on a full-time basis, and of course the significant funding that's been made available to councils to make it work. Can I ask the First Minister how the Scottish Government is working with local authorities to ensure that for parents who need to return to work full-time, appropriate childcare will be in place?
First Minister.
Well, we're working closely with local authorities on a whole range of different issues. Local authorities, of course, are on the Education Recovery Group that the Education Secretary convenes. And obviously, the objective of getting young people back to school full-time is for the sake of young people and their education, but it is also important as a support to the economy because it helps parents who need to go back to work to have the childcare that they need. And also, I referred earlier on to the updated guidance that we're publishing today for early years providers, which adds additional flexibility into childcare for preschool children as well. So we will continue to work with providers and with local authorities as we try to get this sector as a whole back to normal as quickly as possible.
Annie Wells to be followed by Ross Greer.
Thank you, Presiding Officer. Scotland's census is vital for future planning and making sure each part of the country gets its fair share. More than ever, this pandemic has shown how vital it is to have accurate data to inform the government's decisions. Can the First Minister explain why the census is going ahead in other parts of the UK and is being delayed in Scotland? And has the First Minister refused the help of the ONS to compile this essential information?
First Minister.
I'm certainly not aware of having refused anything, but I'm happy to ask Fiona Hislop to write to Annie Wells in more detail about this and set out some of the factors and issues that informed the decision. I can say it's not a decision that was taken lightly. It's one that I interrogated very closely, as would be expected. And I won't go into all of the detail of this right now, but there are some differences in how the census data is gathered in Scotland to other parts of the UK, which is a factor here. But the clear advice from National Records of Scotland was that it would not be possible to do the census safely and robustly in the existing timescale because of the impact of COVID, and that therefore their advice was that to do the census properly and for us to have confidence in the robustness of that necessitated the revised timescale that we have announced. But I'm happy to get Fiona Hislop to write to the member with more of the detail of the factors that drove that decision.
Ross Greer to be followed by Richard Lyle.
Thank you, Presiding Officer. I've been contacted by a number of school staff who have a range of questions about face coverings and how their health is protected when schools reopen. Many, understandably, are asking why a 5-year-old is required to wear a mask for a short trip into a shop, but 15-year-olds are not required to wear a face covering in a classroom environment. But one specific concern that's come up quite a lot today is that teachers would be recommended to wear a face covering if they're within 2 metres of pupils for more than 15 minutes. Due to the capacity and physical size of most classrooms across Scotland, many teachers are taking that as a recommendation that they should be wearing a face mask throughout most of the day in school. Could the First Minister confirm if that is the case and if it is acceptable for teachers to wear a face covering all day if they believe that's necessary to protect their health?
First Minister.
I wouldn't say that my conclusion is that the advice in the guidance that's been published today comes to that conclusion for the majority of teachers. But I would say a number of things. I appreciate members will probably not have had the opportunity to see the guidance that has been published today. There is a fair degree of detail in there about face coverings. There is no general requirement in schools to wear face coverings. And I think a bit like physical distancing for older pupils, where we're recommending that happens where possible in schools, but it's not absolutely mandated, but we're still asking older children to physically distance out of schools. There will be different considerations in different environments, and sometimes that can appear anomalous and inconsistent, but it is informed by the advice and the evidence of the risks of transmission. Teachers will be advised to wear a face covering if, as Ross Greer said, they can maintain physical distancing and are closer than the recommended distance for a period of time. But more generally, anybody who teacher or young person who feels that they want to wear a face covering because they feel it would make them feel safer should be supported to do so. At every turn in the development of this guidance, as the Deputy First Minister will be able to testify to personally, we have tried to be very mindful about the risks and how we mitigate those risks, while on the other hand creating as normal a feeling environment for young people in school as possible, because I think that is also conducive to their education. So these issues will continue to be very carefully thought through and decisions reached in that precautionary basis.
Richard Lyle, to be followed by Beatrice Wishart.
Thank you, Presiding Officer. First Minister, can I firstly thank you for the funfair announcement, and I refer members to my register of interest. I was pleased to hear the update on the successful pilot with NHS Lanarkshire and NHS Louisa Jordan, which saw 315 patients receive ophthalmic and plastic surgery outpatient consultations since the start of July. Can the First Minister provide an update on the plans to expand services, possibly also including cancer treatment amongst other services at the hospital, and how the NHS intend to increase the number of patients seen at this hospital?
First Minister.
Can I thank the member for that question? I visited NHS Louisa Jordan personally on Monday to see the work that they've been doing. I'm hugely grateful and relieved that that hospital hasn't been needed for its intended purpose, and although we can't be complacent about that, but while it is there, I think it is really helpful and important that we use it to try to contribute to the wider NHS effort. It has done by Monday, it was more than 300 outpatient consultations for orthopaedics and plastic surgery. I spoke on Monday to staff and to some patients, and they were all very complimentary about the facilities there and the important contribution that it was making. That has been a pilot, so there are now, and when I spoke to the Chief Executive on Monday already, there were discussions planned, and I believe probably also underway with other health boards about extending that, and also looking to extend not just the territorial reach of it, but to extend the range of procedures or consultations rather that might be undertaken there, x-rays for example. And if it is possible to look at some consultations for cancer treatment, then we will certainly do that. We want to maximise the use of it because it helps us reduce backlogs in the NHS, but it also means that a valuable facility is not lying doing nothing. And I'll just take the opportunity before I finish this answer to pay tribute to everybody who's been involved in creating the NHS, Louisa Jordan, and all those who are working in it just now.
Beatrice Wishart to be followed by Maureen Ward.
I've been contacted by constituents who rely on adult daycare and respite services. The past few months have been intense and more challenging than usual and for them and their special needs adult children. One exhausted father told me last night, "We always get left behind." These families need a break and to see a chink of light at the end of this long tunnel, but there appears to be a block in the road because of delays to guidance. So can the First Minister please give my constituents some indication about the timescales of reopening these much-needed services?
First Minister.
Beatrice Wishart raises a really important issue, and you know, this situation has been difficult for everybody, but there are some groups of people that I absolutely recognise it has been more difficult for than others, and people who would normally have access to respite, that is definitely one of the groups. Rather than try to give a detailed answer right now, because Beatrice Wishart has said that there has been a suggestion that there's some block on guidance. I want to go away after this and look into where the guidance is, if there is a block, what that might be and how we take that away. And I'll undertake to come back to her, hopefully very soon, to give her the detailed answer that she can then convey to her constituent.
Maureen Watt to be followed by Murdo Fraser.
Thank you, Presiding Officer. Can I thank the First Minister for the clear and concise way in which she communicates the vital messaging on this pandemic. But can she confirm that the messaging is communicated effectively in all the languages, or most of the languages, used by those who choose Scotland as their home, including the Eastern European languages, the first language of many in my constituency?
First Minister.
That's a really important issue, and I want to assure Maureen Watt that we are totally committed to ensuring that all public health messaging is accessible to all communities across Scotland. It's vital that that is the case, and I represent a constituency where, in some of the schools in my constituency, upwards of 30 languages are spoken, so I understand the necessity and imperative of this. The 2 national COVID door drops that were sent to every home in Scotland were available in a range of languages and accessible formats. The core national facts campaign has been translated into 32 languages, and we've worked with community partners on accessible materials for ethnic minority communities who have limited or no literacy in English, and that includes easy read and audio materials. We're also working with NHS 24, NHS Lothian and NHS Greater Glasgow and Clyde to provide public health messaging on NHS Inform in multiple languages and accessible formats, and currently those materials are available in 14 different languages, but we hope to extend that in the period to come.
Murdo Fraser to be followed by Sarah Boyd.
Thank you, Presiding Officer. There are many people in Scotland's faith communities who struggle to understand why there is an arbitrary cap of 50 on indoor gatherings when many church and other buildings could accommodate with social distancing much greater numbers. At the same time, there is no limit to those who can gather in pubs, in restaurants or in cinemas, and today the First Minister indicated that theatres and indoor entertainment venues could reopen from the 14th of September, presumably without any cap on numbers. So why are places of worship being treated differently, and when might this change?
First Minister.
I want to give an assurance that places of worship are not being treated differently in the sense that we're not thinking very carefully about these issues. I've personally had a discussion in the last few weeks with leaders of all of our faith communities to understand, I do understand the concerns they have, and at the time they were concerned, rightly and understandably, about pubs opening before places of worship were allowed to open for communal prayer, and we brought those dates into alignment. I recognise, because often I have to go through the process of understanding this myself, that there are things that on the surface appear to be anomalous, but they are driven by different environments and how people interact in different environments and how people breathe in different environments. So there is a lot of thought goes into these things. I would hope that over the period to come, the limit both in communal prayer and worship and also on events like weddings and funerals can be increased, and we're looking at that carefully. But the final point I would make, I suppose, is not specific to places of worship. It's a more general point that we can and we do and we must look at all of these changes on an individual basis. But the other thing we have to do is look at it all on a cumulative basis. And that's been particularly important in this review because of that central objective to get schools back. So we're being more cautious about the cumulative impact of changes that we are making than we might otherwise have been able to be if the importance of schools wasn't there so centrally. But we will continue to keep all of these things under review, and we will talk with different groups and sectors as we do so.
Sarah Boyack to be followed by Bob Doris.
Can the First Minister explain what she meant by her statement that social distancing in secondary schools should be maintained where possible, and the guidance says where there is no impact on capacity? What does that actually mean in practice? Don't school students and staff need more clarity on safety when they return? So will she commit today to ensuring councils have the funding they need to ensure our schools are safe both when they open and also going forward in the light of experience?
First Minister.
We wouldn't be announcing the decisions we are announcing today if we weren't satisfied that what we were doing was safe, and I think that is important to stress, and we will obviously look very carefully at the experience of opening schools to make sure that that assessment doesn't change. In terms of what I said in my statement, the advice we got was that physical distancing in general in the school estate was not required, but that balance of judgment was different in secondary schools to primary schools, particularly for pupils in the senior phase. So we have said that where it is possible, distance should be maintained in secondary schools, and as I said, particularly for senior pupils. And that means that they should utilise available space in a way to do that. But if doing that would, if space constraint is such that doing that would mean that all pupils couldn't be back full-time, then the advice is that, that getting pupils back to school full-time is more important than the physical distancing, albeit with all of the other mitigations that are advised and are in place. And that was an aspect of this that we looked at very carefully, guided, of course, by the advice of the scientific subgroup on children and education.
Bob Doris, to be followed by John Scott.
Presiding Officer, I've been contacted by several youth football teams in my constituency who are pleased to see the return of team sports but face significant challenges to secure sports facilities, some of which operated by Glasgow Life, and they remain closed. Teams would be happy to return initially using only outdoor facilities with players arriving pitch ready, so no showers, no changing rooms to limit infection. Can I ask the First Minister how the Scottish Government is supporting and working with councils to identify and remove barriers to reopenings such sports facilities as speedily as possible, given many local youth football clubs in my constituency have a lengthy wait before they can get back to training and playing once more?
First Minister.
Thanks to Bob Doris for the question. Since the 13th of this month, children and young people have been able to play outdoor football and other sports in an organised setting where there is sport-specific guidance in place from the governing body. The Scottish FA has agreed guidance with Sport Scotland, and that includes information on hygiene measures and the ability to contact trace as required by Sport Scotland's overarching guidance. We're currently in discussions and preparing guidance for the opening of indoor sport and leisure facilities, again in consultation with Sport Scotland, Community Leisure Scotland, the Scottish Leisure Networking Group, local authorities, Leisure Trust, the hospitality sector, trade union and governing bodies are all involved in that. We recognise there might be financial challenges to opening only outdoor facilities where they're part of a larger facility, so we're continuing to discuss that with COSLA. And as I've indicated today, the current indicative date for the reopening of indoor leisure facilities is the 14th of September.
John Scott.
Thank you, Presiding Officer. And can I thank you and the many members and members of staff who have sent me messages of support and encouragement during my illness. Presiding Officer, the First Minister will be aware of the significant loss of life in care homes in my Ayr constituency. The First Minister has also warned us of emerging threats of a second wave of the pandemic. Can the First Minister assure Parliament that lessons have now been learned about how best to deal with COVID in care homes? And if this is so, can the First Minister tell Parliament what some of these lessons are that have been learned as we prepare for a potential second wave?
First Minister.
Well, can I thank John Scott for his question? Lessons are, I would hesitate to say that we have learned all the lessons we need to learn. Lessons are being learned on an ongoing basis, taking account of the updated advice and knowledge and understanding we have of the virus. And when we look back, and some of these issues have been raised in the Chamber today and on previous occasions, changes to guidance we've made, the development of our position around testing in particular, some of the implementation of those lessons can already be seen, but we are continuing to look very hard at the different aspects of how we dealt with the pandemic in care homes and indeed more widely to make sure that we continue to inform our approach for the future. I fervently hope, and much of what we're doing just now is designed to maximise the chances of us avoiding either a resurgence of the first wave, which is the most immediate challenge, or a second wave later in the year. But we cannot guarantee that that won't happen. So these exercises are really important and will continue almost on a daily basis within the Scottish Government, and we'll continue to keep Parliament updated of any implications of that for changed guidance or a changed approach to anything that we're doing.
Thank you very much, and that concludes First Minister's questions. We're going to move on to the next item of business, which is a statement by Michael Russell on the internal market. We'll just take a short pause, Minister, if we may, just for members to change seats, and myself too.
Thank you. The next item of business is a statement by Michael Russell on the internal market. The Cabinet Secretary will take questions at the end of his statement, so there should be no interventions or interruptions. And I call on Michael Russell. Cabinet Secretary, please.
Thank you, Presiding Officer. Presiding Officer, on the 16th of July, the UK Government published a white paper on the UK internal market. The Scottish Government believes that the unilateral proposals made in that white paper without proper consultation with the devolved administrations are unacceptable and unnecessary. I'm therefore grateful, Presiding Officer, for the opportunity to make a statement on the matter. Once we have seen the final legislation, the Government will provide a full and comprehensive rebuttal of what is intended. But there is enough in this document and enough information now coming from stakeholders about their concerns to make us believe that we must immediately start the process of defending Scotland against such a blatant power grab. The UK Government is allowing only 4 weeks for consultation on its proposals in the paper. This is clearly inadequate, and it's likely to prevent proper scrutiny. So can I say at the outset that whilst we will be submitting a clear note of our opposition to the proposals within the timescale and circulating that widely, we will also publish more comprehensive information as the issue unfolds, and particularly once the legislative consent process is underway. Presiding Officer, the purported purpose of these proposals is to secure, and I quote, a UK-wide approach to ensure that the seamless trade across the UK's internal market is maintained by providing a market access commitment. But there is in fact no threat to that seamless trade. So this is a naked political ploy, a predetermined draconian solution in search of a non-existent problem. Two principles, mutual recognition and non-discrimination, well known in EU law, are to be enshrined in the new legislation. But far from, and I quote again, minimising domestic trade costs, business uncertainty and bureaucracy and protecting our national life, enforcing these principles in the way proposed will increase bureaucracy and make life more difficult for every business and consumer in Scotland. The real threat to the prosperity of these islands comes not from the devolved administrations, but from the current UK government. It is the UK government which is causing chaos, confusion and massive cost by its ideological pursuit of a hard deal, low deal or no deal Brexit in the midst of the worst recession in centuries and an unprecedented pandemic. As of today, some 5 months before the end of a transition period that could and should have been extended, there is no certainty on tariffs, on customs, on cross-border flows of data and people, or on regulations. In fact, Presiding Officer, the only certainty is that these new proposals would undermine the high quality and standards that Scotland has set for food production and animal welfare for the sole purpose of allowing the UK to do bad trade deals. That point was made effectively by the distinguished European jurist Sir David Edward when he observed the principles of mutual recognition and non-discrimination are not simple matters. For example, the White Paper, he says, omits any reference to the principles of proportionality and subsidiarity, which are essential ways of balancing and reconciling conflict. And he also points to a huge volume of European case law and other writing on what he calls a highly complex and sophisticated subject. So these proposed changes undermine not just the basic foundations of devolution, but also all existing mechanisms for cooperation, the development of common frameworks, and the entire list of devolved competencies. In reality, Presiding Officer, the actual purpose of these proposals is all too clear. The UK government intends to ditch the high regulatory standards we have enjoyed as a member of the EU and wants to do so without seeking consent from the people of Scotland. Now, and we can be sure that this is the purpose of the proposals because there is already a workable and constitutionally appropriate way forward to deal with any actual issues that arose from any threats to internal trade, if those ever happened. That way forward is to do what we're already doing, to bring into effect the common frameworks currently being negotiated between the UK government and devolved administrations in line with the principles agreed in the JMC as far back as 2017. Indeed, the White Paper itself, in paragraphs 87 to 94, sets out the Common Frameworks Programme and admits, and again I quote, that it is already creating an intergovernmental policy development and decision-making process which provides high levels of regulatory alignment in specific policy areas along with roles and responsibilities of each administration. That's paragraph 88. The paper also points out correctly that common frameworks can and do work within the devolution settlements and respect the democratic accountability of the devolved legislatures. The Scottish Government has engaged in good faith in the cross-UK project to develop these common frameworks in line with the agreed principles. We are not the ones who are now tearing up previous agreements in order to veto constructive discussion and impose an outcome designed and desired only by Westminster. What the UK Government wants is not smooth trade, but to take back control. And not just from the EU, but from the people of Scotland and Wales and Northern Ireland. And it certainly does not want anything to stand in its way, as it willfully dismantles a high-quality system of regulation and protection we inherit from our years in the EU. The effect of the proposals would be to prevent this Parliament from requiring goods or services produced elsewhere in the UK to meet the standards decided on by this Parliament. In other words, if the UK Government can simply change the rules for England, probably using the English Votes for English Laws procedure, which excludes Scottish MPs, Scotland would just have to accept that decision. Helpfully, the White Paper itself even contains examples of where it could do so. On page 77, in a section headed Cost of Regulatory Divergence, there is a case study on deposit return schemes. Oh, really? On page 78, there is an example concerning food labelling. On pages 79 to 82, there is a case study on food manufacturing, which covers food hygiene, recycling, animal welfare, and environmental matters such as pesticides. And page 82 also specifically mentions minimum pricing as a regulatory restriction. And on page 85, the paper discusses building regulations and granting construction permits. That's a considerable range, Presiding Officer, and they're only examples. Of course, the mutual recognition principle is intended to be just that, reciprocal. The market in England will have to accept standards set in Scotland, Wales or Northern Ireland. But it is very clear that if that were ever to happen in a way that disadvantaged the current Tory UK government, before you could say the tail wagging the dog we would find that only rules made in Westminster could change the market in England. Presiding Officer, my final points concern the implications of these proposals for devolution in governance. There is no commitment in the paper to seeking legislative consent from this Parliament. No recognition that these matters are devolved or affect the competence of this Parliament. The paper clearly says in paragraph 154, the evolution and overall shape of the UK's internal market will be overseen by the UK Parliament, and that key decisions will be put to the UK Parliament for approval. The implication is that anything in the underpinning legislation will be reserved from now on. This Parliament will lose any say, even on matters initially excluded, like minimum unit pricing. The legislation outlined in the paper will require legislative consent under the Sewell Convention, and the Scottish Government will be recommending in the strongest possible terms that this Parliament does not give any such consent, and that the UK Government therefore respects that decision in line with the rules of our constitutional system. The paper also makes clear the intentions of the UK Government to centralise control in other areas. Most notably and explicitly, the paper sets out its plans to reserve the subsidy control regime. It makes clear that devolved administrations will have no role in designing that regime, and that this Parliament will have no role in approving it. Paragraph 173 says the future subsidy control mechanisms should be the responsibility of the UK Parliament to determine. Again, reserving subsidy control will require the consent of this Parliament under the Sewell Convention, and again the Scottish Government will be strongly advising this Parliament to refuse that consent, and the UK Government must respect that decision. And at paragraphs 128 and 182, the paper talks of clarifying spending powers of all levels of government and for the UK Government to construct replacements of EU programmes. Again, it does not take much thought to realise that these paragraphs mean, amongst other things, the shared prosperity fund, replacing devolved responsibility for the current EU structural funds. The intention is that those funds will become a reserve matter and solely controlled by the UK Government. In all this, Presiding Officer, there is a consistent pattern emerging regarding the Tory view of UK governments. This insists on total freedom of action for the UK Government, unrestrained by any requirement to negotiate or compromise. It wants substantial constraint on powers presently held by the devolved administrations. That is the agenda, and it is being pursued with vigour. The Scottish Government is committed to cooperation, but it will not be bullied. There are alternatives to these ill-conceived proposals, including taking the Voluntary Common Frameworks programme to its anticipated conclusion. And finally, Presiding Officer, none of this was mentioned, even in passing, during the 2016 EU referendum, or indeed in the 2014 independence one. In 2014, we were exhorted to lead, not leave. We were told that a no vote would deliver a better and fairer Britain. And of course, we were assured that our place in Europe was secure. In 2016, we were promised that this Parliament would gain more powers, that we would be free to make our decisions. And even, and this is Michael Gove himself speaking in June 2016, that if the UK left the EU, then on migration, and I quote him, it would be for Scotland to decide, when the reality is that the UK Government are forcing through an end to freedom of movement against the explicit wishes of this Parliament and the people of Scotland. Presiding Officer, not a word that has been said to us in the last 6 years about these matters has turned out to be true. So it takes no great prescience to realise that all the promises being made now will be equally hollow. It is not too late for the UK to turn back from this route, but I can assure Scotland that if it does not, then this Government will fight these proposals tooth and nail in every possible place and with no intention of giving way. I hope it will enjoy the support of the whole Chamber in so doing.
Thank you very much, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow about 20 minutes for questions, after which we must move on. The next item of business. Can I ask members who wish to ask a question to email the business team now, as they did before? And I now call on Murdo Fraser. Mr Fraser, please.
Can I start by thanking the Cabinet Secretary for advance sight of his statement? However, any hopes that he would drop his hysterical and misleading rhetoric on this issue have been quickly dispelled. The UK internal market is vital for Scottish business and the economy, supporting over 500,000 jobs. Scottish producers need to be able to sell to our largest marketplace, the rest of the UK, without restriction or barriers to trade. Sadly, this Government doesn't need to understand that simple point. They would rather engage in constitutional grievance mongering than consider what is best for jobs. And what we have heard today from the Cabinet Secretary simply reinforces the view of one of this government's own economic advisers, that there is no one in their ranks who understands business or the economy. So I have two questions for the Cabinet Secretary. Firstly, not one SNP politician has been able to give a simple example of a power currently exercised by this Parliament which will be taken away by these proposals. There was nothing in the statement about that today, Presiding Officer. Can he do any better? And secondly, can he confirm that in relation to all the powers we are talking about, the SNP want to see every last one returned to Brussels at the first opportunity?
Cabinet Secretary.
Presiding Officer, let me deal with the second question first. The SNP wants Scotland to be in the mainstream of Europe, to be a member of the European Union. Moreover, that is what the people of Scotland want, because that's what they voted for and have repeatedly voted for. So if Murdo Fraser is not happy to be part of a community of 27 nations, with our joining would be 28, that is freely sharing decision-making, he is entitled to that position. But I tell you, not a single European nation within the single market would be treated or has been treated in the way that the UK intends to treat Scotland through this document. And that is clear from the analysis from David Edwards, which I quoted. The reality is there is no proportionality in this, there is no subsidiarity in this, there's no question of minimum standards, there's no question of national interest prevailing in terms of decisions. This is purely take it or leave it, because we know what we're going to do from the UK government. On the second question, let me make a point to this. This is a line, not an original line. It was Michael Gove's line last week, and it continues to be Michael Gove's line. And I'm sure Murdo Fraser enjoys quoting it. But actually, I could stand here all afternoon. In fact, I probably should just take Schedule 5 of the Scotland Act and start to read out what's reserved and then talk about everything else. Because every single power that the Scottish Parliament has can be undermined and taken away by these proposals. Every single one. I've mentioned food standards, but let me just go, Presiding Officer, to what I said in my statement. Clearly, Murdo Fraser wasn't listening. There is deposit return schemes, food labelling, food manufacturing, food hygiene, recycling, animal welfare, environmental matters such as pesticides, minimum pricing, building regulations, granting construction permits, all of them are actually in the white paper as examples. So my advice to Murdo Fraser, and to Michael Gove is read your own white paper, because that's what you're going to be taking away.
I call Alec Rowley, please.
Thank you, Presiding Officer. The problem is that it is looking like it's take it or leave it, and that would not be acceptable, and it would be a failure to stand up for the rights of this Parliament and for the people of Scotland to simply take it on the instruction of Boris Johnson. I would have thought that one bit of certainty that the whole country would want at this time would be that our NHS will never be on the table of any trade negotiation. But the Tories, with their majority in Westminster, have ensured that there is no safety net for our NHS when it comes to future trade deals. This is not right, and there are many aspects of this white paper that are not right. We need to see what the legislation brings forward, but can I ask the Cabinet Secretary, do you agree that we must establish the principle that where we are dealing with devolved areas that require a common framework to be put in place, then that common framework must be agreed by the administrations of the UK coming to the table as equals? And does he agree that the best way to protect the internal market is by the collaboration and cooperation of all nations?
Cabinet Secretary.
I agree, Presiding Officer. I think Alec Rowley has two very significant points there. The first one is that the negotiations on the frameworks continue. And it would be perfectly possible in that favourite word of the Tories to intensify those negotiations to complete that task before the end of the year. And there will be no difficulty in so doing. The number of common frameworks which we agreed that we would need was 24. There is a difference about state aids, but we could get all that work finished. And indeed, I know that that is the Welsh Government's view as well, that we could do that job. And we will be part of that. What we won't be part of, what we won't allow to happen, is the power grab. There's a second point the member makes about public services, which I just want to dwell on for 1 second. Martin Callanan, Lord Callanan, in the House of Lords yesterday, answering a question from David Wigley, gave the game away on this. Because when he was asked if there was any dispute resolution procedure within these proposals, he said, no, we have a fine court system. I presume he was referring to the English court system. I'm not sure he knew there was a Scottish court system. There's a fine court system and it can have its place. What that does is it opens the door to any company, particularly coming into the country after a trade deal, to say about public services, Scottish public services, no, that's not fair. We are allowed to compete for these because we're allowed to compete for them south of the border, and therefore we will insist upon that in Scotland. So the courts will be used, unfortunately, by such unscrupulous companies to undermine Scottish public services. And why? Because the Tories are going to allow it to happen. Indeed, they're going to encourage it to happen.
Thank you. I have 15 minutes and 11 members, so please can I have short questions so everyone can get in. Patrick Harvey to be followed by Willie Rennie. Mr Harvey.
I'm grateful for the advance copy of the statement, and very clearly this white paper is a profound threat not only to Scottish democracy but also, in the words of the Welsh Minister for European Transition, it facilitates a race to the bottom on standards from their perspective as well. Isn't it the case also that in combination with the UK government's trade bill and its policy in that area, this potentially locks in all future governments throughout the UK to the same race to the bottom agenda, because the people in government in the UK at the moment recognise that their failed free market ideology is incompatible with strong governments that are able to regulate in the interest of the environment, human health or public services. They recognise that's a fundamental contradiction, and they want to stop all future governments from having the power to act democratically.
Cabinet Secretary.
Absolutely, there is a strong deregulating agenda south of the border, which is designed to encourage private profit, mostly from their friends, and in those circumstances they are determined. I'm not going to resile from what I think is blindingly obvious. And in those circumstances, what they are trying to do is to drive deregulation down the throats of administrations who know that having strong public services and ensuring there is effective regulation is the right way forward, as indeed, right across Europe, countries know that. The odd one out is the UK, and the UK is determined to try and make sure that it gets its way with Scotland and Wales and Northern Ireland, and we will not allow that to happen.
Willie Rennie, followed by John Mason.
It is deeply frustrating that the UK government continues to be cack-handed in its relationship with the Scottish Government. Surely what we need is an effective dispute resolution procedure between the nations and regions of the UK to agree the way ahead on areas of common interest like this. It's what we've argued for before. It would be good to have the Scottish Government's support for that proposal.
Cabinet Secretary.
Entirely support that proposal. As part of the intergovernmental review, presiding officer, I can tell this chamber that there was meant to be that at the heart of the new proposals on governmental relations. And there's two problems now with that. One is that nothing has come from the UK government. We have been waiting to see this document for months. It has had a gestation period much longer than an elephant, and we have nothing at all from the UK government on these matters. But the second problem in this is what Martin Callanan said yesterday in the House of Lords. If there is going to be an entire reliance upon the courts for these matters, there can be no effective dispute resolution procedure because it will be overruled by the courts. So in these circumstances, I am happy to say, and to make common cause with Willie Rennie on this, if the UK government was to bring a dispute resolution procedure and a set of arrangements that treated the four nations of these islands as equals, we would be there to agree it. We have other ambitions, but we'd agree it. Of course we would agree it. The Welsh would agree it. But they're not bringing that forward. What they want now is simply to intervene legally to stop us doing things. And I do hope we'll have the support of Willie Rennie and his party in resisting that.
John Mason, followed by Donald Cameron.
Thank you, Presiding Officer. Cabinet Secretary, can you confirm, it seems to me that within the EU, for example, with structural funds, we had quite a lot of freedom as to how to act within a framework. Whereas now it looks like within the UK, with the Shared Prosperity Fund, that we're going to have virtually no freedom to move at all?
Cabinet Secretary.
I think that's an inevitability of where the UK government are presently going, and we must oppose it very vigorously. The idea is that the Scotland office and the Welsh office would administer these funds, building an empire for the Secretary of State for Scotland and the Secretary of State for Wales, and ignore the devolved administrations. These are funds that are already administered by the devolved administrations. And there's not been a single argument in favour of taking them away. They should be administered in anything more simply and closer to people. But, the Secretary of State for Scotland wants to have his empire, and he wants money to fund that empire, and that's where he's looking to get it.
Donald Cameron, followed by Joan McAlpine.
The Fraser of Allender Institute estimates that over 500,000 jobs in Scotland are supported by demand for our goods and services from the rest of the UK. Given that, and in light of the fact that the Scottish Government withdrew from work on the UK internal market over a year ago, will the Cabinet Secretary commit to working with the UK Government to establish common frameworks that will prevent unnecessary damage and thus avoid putting hundreds of thousands of Scottish jobs at risk?
Cabinet Secretary.
I'll take the positive part of that question first. Of course, if Donald Cameron is capable of persuading, and he is a persuasive man, if he is capable of persuading his colleagues south of the border to withdraw these proposals and to return to the table on common frameworks, then I will support that. And I've made that clear. I've never left the table on common frameworks. We withdrew from the discussion of the internal market because it was obvious where this was going. It was absolutely obvious. The UK government intends to oppose. We made it clear on common frameworks we would not have them imposed. But for 2 years, over 2 years, we have been able to agree on common frameworks. And indeed, every 3 months, the relevant Secretary of State in England, it's presently Michael Gove, has to publish a report that says the common frameworks material is going ahead and there's been no need to impose. That's happened in every single report. Now we cannot say that, because what they will now do is try and ignore that and impose this. So if Donald Cameron can persuade the UK government to withdraw this badly drafted and malicious white paper, then I will agree to that. But if he cannot, then I won't.
Joan McAlpine, followed by James Kelly.
Thank you. The UK government has signalled its intention to grab powers to set laws around state aid. What are the implications of this for the Scottish Government's ability to protect strategic industries and jobs here in Scotland?
Cabinet Secretary.
It is essential that there is an effective state aid regime. And moreover, given the role that the Scottish Government has had in industrial strategy and in developing and building business in Scotland, it's important that it is done with a knowledge of the Scottish economy. And that is why state aid has devolved. And the reason that the UK government want to reserve it is because they either wish to create a much lighter regime or maybe no regime at all. People may have seen speculation in the press that this is being driven by Dominic Cummings, and what he wants is no state aid regime. Now, they won't be able to get an agreement with the EU if they insist upon that, but that may be where they are going, to have no regulations. And why would they have no regulations? Because they could spend money willy-nilly on buying votes. That's the reality of it. That's what they will endeavour to do. So we need an effective state aid regime. Again, common frameworks can provide that. So if Mr Cameron is compiling a list of those areas where work could be done, here's another one he could put in. We could have that discussion through the common frameworks on the state aid regime. But they will have to, the UK government will have to withdraw what is in this paper, because that is a naked power grab, and it is trying to find a solution to a problem that does not exist.
James Kelly, followed by Kenneth Gibson.
The devolution settlement must be protected, but any change to powers or trading relationships must give regard to economic impact. Can I ask the Cabinet Secretary what tests the Scottish Government propose in order to ensure that any changes to powers will also protect jobs and economies within the UK internal market and also within Scotland?
Cabinet Secretary.
The member is aware that devolution as the established constitutional order has checks and balances within it. But those checks and balances do not prevent internal trade. In fact, it is quite obvious internal trade has grown since devolution was established. But they allow priorities to be set. So anybody who is endeavouring to impose something different, as the UK government is trying to whip up fears about the UK internal market, which are non-existent. But of course, we will publish, as I've said, over the next few weeks, and as this process continues, more evidence that will show that the frameworks process is the right process to go through, and will also indicate the positive nature of ensuring that by using the frameworks, we can encourage some economic activity. Remember, however, and I'm sure the member does remember, that Brexit will be economically disastrous. So we will be doing this against a declining economy, and the UK government will not only have the disaster of the COVID recession, it will have a self-inflicted disaster of a Brexit recession as well. It will be very hard to cope with both. In fact, it will be impossible to cope with both.
Kenneth Gibson, followed by Alexander Burnett.
Thank you, Presiding Officer. One of the powers the UK Tory government seeks to deny Scotland
To our obvious detriment is the ability to decide on where to provide subsidies, impacting directly on this Parliament's capacity and capability to support our economy. Can the Cabinet Secretary provide an example or two where such interventions have taken place, which in future will be at the mercy of capricious Tory ministers?
Cabinet Secretary.
Well, quite clearly there's an elaborate cross-government process where money is allocated and used in order to develop either industry, business, agriculture, fisheries. And in these circumstances, that's a sensitive matter. The way in which money comes in and the way in which other monies come from elsewhere has to be judged carefully so it does not distort competition. And a knowledge of the economy is extremely important. If you take that elsewhere, which is what is probably going to take place, in fact, that's what they want to take place, then there will be that lack of knowledge and they will not be able to do some of the important things, encouraging, for example, small and medium-sized enterprises, and encouraging the growth of the digital sector, or encouraging something like crofting, which is something that's dear to my heart. That will not be able to be possible if there is a state aid regime which is administered from elsewhere by people who know nothing about it.
Alexander Burnett, followed by Gordon MacDonald, please.
Thank you, Presiding Officer. Now, this subject's clearly going to be a lengthy source of grievance for nationalists. And as for his comments on constructive engagement, last year it was the Cabinet Secretary who pulled his civil servants out of joint work with the UK government to strengthen the internal market on the spurious grounds there was no such thing. So as a starting point, does the Cabinet Secretary now accept there is a single market, and it's his position that puts this at risk?
Cabinet Secretary.
Well, not surprisingly, I don't accept that. But, of course, the member needs to be accurate in his terminology. The question of whether there is a single market, on the definition of a single market as understood in Europe, the answer is no. Is there an internal market? Yes, there's an internal market. Can you trade across different regulatory regimes in an internal market or globally? Yes, of course you can. So unless the member believes that there should be no trade across any different regulatory borders or systems, his position is, shall we say, incoherent.
Gordon MacDonald, followed by Claudia Beamish.
Thanks, Presiding Officer. Scotland is a world-leading food and drink sector which is renowned for its high quality. Much of the growth in the sector is down to its excellent reputation. Does the Cabinet Secretary share my concerns that if the UK Government accepts lower standards, then this hard-won reputation could be compromised?
Cabinet Secretary.
I do accept that, and I know that's also the view of many niche food and drink manufacturers and more widely the industry itself. There will be very substantial concern about this, and in these circumstances the right way to defend that is to have means by which you can defend niche or growing industries. One of the great successes in Scotland in the last 10 to 15 years has been the growth of Scottish food and drink. It has been wonderful, and we know many, many producers who do exceptional jobs and do exceptionally well. Their livelihoods are put at risk by these proposals.
Claudia Beamish, followed by Rona Mackay.
Thank you, Presiding Officer. Can I emphasise the 4 EU environment guiding principles of precaution, prevention, rectifying pollution at source and on polluter pays, with which I know the Cabinet Secretary agrees? What, in his view, is the best way to maintain and build on European standards for our environment across all 4 nations, and of course in relation to devolved issues, and to try to ensure that the common framework reflects these?
Cabinet Secretary.
I thank the member for that very good question, and she and I both share a passion for getting this right in terms of environmental regulation. Now, the Cabinet Secretary for the Environment is bringing forward with me the Continuity Bill, which will have proposals about keeping pace with European environmental regulation. But we should also make sure, and of course the Northern Irish administration in terms of the regulatory standards that they will have the EU will also be keeping pace and developing alongside EU standards. We need to make sure that we can square that circle through the framework process, and we do that by negotiation. What this actually does is simply sweep that away and say we're not interested in negotiation, we're going to impose standards that are set at Westminster, probably without involving Scottish MPs. That is the worst way of doing things. And I'm glad I think the member is going to support us trying to stop that happening.
And Rona Mackay.
Thank you, Presiding Officer. It's clear that Scotland's democratic decisions have been actively undermined by the UK Government. Does the Cabinet Secretary agree that the only way to properly protect Scotland's interests is by becoming an independent country?
Cabinet Secretary.
Well, as the member knows, it's amazing when a word of truth is spoken how Tories really get excited, isn't it? They can't really take a word of truth. I've spent my political career believing that Scotland should be a normal nation. I don't resile from that in the slightest. But I do also know there are people in this chamber who do not agree with me in that. And people who do not agree with me, but who recognise the importance of devolution, as we've heard from Labour members, we've heard from Liberal members, then I am very glad to work with them to make sure that the devolution settlement is protected. Because without the devolution settlement in place, then we will have even more problems. That is the nature of the agreement that I have sought and have on a practical basis, for example, with the Welsh government, the Welsh Labour government, who we do not agree. Mark Drakeford and I very early on said we do not agree on the final destination. But we're on the same journey here, and we're on the journey to make sure that our countries can have effective legislatures and can protect and promote the good things in our countries. So I welcome that collaboration. But will I ever walk away from the idea of independence? No, and it's coming yet for all that.
Thank you. That concludes questions on the statement. And as there is no other business, I close this meeting of Parliament. That said, can I remind members to remain in their seats for a test of the voting system. Thank you very much.
How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a balanced on. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.